It was announced just yesterday the nasal vaccines arrived at the Department of Public Health, and they're in the process of determining how the supply will be distributed. The Guam Memorial Hospital is gearing up to get their workers vaccinated. Spokesman Connor Murphy.
The CDC has recommended that healthcare workers be one of the first groups to receive the H1N1 flu vaccine once it's available. So we're hoping to get it here at GMH this week and get the necessary training done so it can go to our staff. It's going to go to the staff that have direct patient contact first, like the doctors and nurses, and then go to the rest of the staff afterwards.
And while the CDC and Public Health have assured there is enough of a supply to vaccinate everyone, there are certain restrictions where the nasal version is concerned.
Since we're getting the flu mist vaccine first, that vaccine does have some restrictions. For example, it has to go to people who are under 49, who are in good health, who don't have allergies to things like eggs. So for staff who don't meet those restrictions, then they will get the injection vaccine once it's available.
Meanwhile, the Department of Public Health is doing its part in the planning. Spokeswoman Mary Lulu Hati says that the hospital, all health care clinics, and emergency responders will be on the list to receive the first of this vaccine.
The vaccines that we received are the flu mist, which is the nasal spray. And right at this time, the priority group will be the healthcare professionals and emergency medical responders. And we're hoping to allow the Guam Fire Department's EMT intermediates to self-vaccinate their own personnel. And again, the age is very strict. It's between the ages of 18 to 49. They must be healthy, no chronic diseases, and no medication. So it's a very limited population at this time for this vaccination or this vaccine that we receive, but we will be receiving more, and the timeline for the mass vaccinations will be forthcoming.
There's been no time frame given as to when the H1N1 shots will be given, but the Department of Public Health expects that it will be within the month. They also assure that there will be enough for everyone.